You're listening to Boomers Today with your host, Frank Sampson.
Well, welcome to Boomers Today. I'm your host, Frank Sampson. And of course, each week we bring you important and very useful information on issues facing baby boomers, their parents, and other loved ones. And again, every week I thank everybody, and it's important that I do because our listeners are growing each and every day. And it's because of all of you sharing with your friends and family some of our podcasts. And I know you're doing that because we have great guests, and I'm not going to be disappointing you today. We have another great guest today who I'll introduce in just one moment. But just to remind everybody, they could listen to the show on one of their favorite podcast stations, certainly Apple Podcasts, Google Podcasts, Spreaker, Stitcher, iHeartRadio, or you could go to our website as well. Either the seniorcareauthority.com website or the boomerstoday.radio.com. So as I say, we have another great guest today, Dr. Judson Brandeis, who is an award-winning urologist and sexual medicine expert, clinical researcher, physician educator, and a caring clinician and surgeon. Over the course of his 25-year career as a board-certified urologist, he has performed thousands of surgeries and pioneered surgical robotics. In February of 2019, he opened BrandeisMD, a national leader in technology and sexual medicine innovations for men. He brings his wealth of expertise and care to his first book, The 21st Century Man, advice from 50 top doctors and men's health experts to help you feel great, look good, and have better sex. So, Dr. Brandeis, thank you for joining us on Boomers Today. Really appreciate it.
Oh, Frank, it's great to be here. Thank you so much for having me.
Yeah, I always like asking our guests, especially, them involved in certain professions, kind of a little bit of background on what got you interested in getting into medicine, and specifically what got you interested in specializing in the field that you're in?
Yeah, that's a great question. So I always wanted to be a doctor, and I was really blessed with an incredible education. So I went to Brown University, and then I went to Vanderbilt for medical school. And then after Vanderbilt, I did a research fellowship at Harvard Medical School in the lab where they did the first living-related kidney transplant, where they won the Nobel Prize. And then I went off to UCLA for residency in both surgery and urology. And then after that, I went off to Northern California, where I joined the local urology group. I ended up heading up the local urology group, being chief of urology at the local hospital, building their surgical robotics program, being the chief of urology for the local HMO, and winning the top urologist in the Bay Area award for the past 9 years. But about 3 years ago, I became really interested in technologies to improve erectile function, that go way beyond the little blue pill. And so I became a regenerative urologist, someone who can help men who no longer have the ability to get an erection for physical intimacy to be able to achieve that. And then beyond that, I got really interested in hormone replacement and then physical rejuvenation for men, especially over the age of 50.
Wonderful. And your first book, did it just come out, or has it been out for a little bit?
It did. No, it just came out like a month or two ago.
Oh,
but really,
wow. So tell us a little bit about that.
Yeah, it was really the synthesis of everything that I've learned about men. Because in order to have physical intimacy for men over the age of 50, you have to be physically optimized. You have to be mentally optimized, emotionally optimized. Your relationship has to be in good shape. And then your sexual health has to be in good shape. And so this book is over 900 pages and 101 chapters. And really, it's about all the things that you have to optimize in order to have good physical intimacy with you and your partner over the age of 50.
Fantastic. And I assume people could get it going on Amazon and other sites as well?
Yeah. So, Jeff Bezos already has enough money. And so if you could go to the 21stcenturyman.com, just all written out in letters, no numbers.
21stcenturyman.com. Okay, great, good. And you have a website as well, right?
Right. So for folks that are interested in seeing me as a physician, or even just to know what I'm doing, just go to BrandeisMD, BrandeisMD.com. And I also have a YouTube channel. So I do a lot of physician teaching. I travel around the country teaching doctors and presenting clinical information and my clinical research. And so if you just go to YouTube and put in BrandeisMD, you can see my research presentations and then my teaching slides for physicians as well.
Great. So, you and I had an opportunity to chat a little bit before we started this podcast, and there's so many different subject matters we could be talking about, but we have to zero in a little bit. But as I told you, many of our listeners are family caregivers, of taking care of an elderly loved one, or could be taking care of an elderly loved one, may be confronted with someone in their family with some form of dementia like Alzheimer's, etc. So certainly you have an expertise on the aging process. Talk to us a little bit about that.
Yeah, the aging in process is very sort of insidious, and it's almost like turning the dimmer switch down on a light for a lot of folks. I mean, if you have a stroke or a heart attack, it's different, but there are a lot of processes in the body that begin to wind down. And one of them is testosterone and estrogen. Obviously, in women, estrogen drops off a lot quicker, but in men, we have what's called the androgen deficiency of the aging man. And each year after the age of 20, men lose 1 to 2% of their testosterone levels. And you'll go to your primary care physician and you're in your 70s or 80s or even 60s, and they'll say, oh, your testosterone is normal. But it's normal for someone who's in their 60s or 70s or 80s. And really, sometimes that's not adequate. So testosterone is our main growth hormone, and we lose muscle, we lose circulation, we lose brain function, we lose our mood, we put on weight when our testosterone begins to wind down. Now, there are other hormones like insulin, like growth factor number 1, and a plethora of other hormones, but testosterone is really the main one. And I do a lot of testosterone replacement in men over the age of 60. And it's really a dramatic effect in terms of helping men build muscle, get rid of fat, improve their outlook in life, improve their libido. And so that's definitely one thing to keep in mind.
Interesting. So you said, and that's very interesting, and I've heard that, and that you go to your doctor and they say, well, based on your age of 66, yeah, your testosterone's fine. Okay, so now what if somebody hears that, what are your thoughts? How should you react to your doctor in that situation?
Yeah. Well, I had a patient the other day. I said, well, your testosterone's normal for an 80-year-old. And he looked at me and goes, yeah, most of my 80-year-old friends are dead.
Right.
So,
Right.
It's just, and as an insurance-based doctor 4 or 5 years ago, I was focused on getting people's testosterone back to quote normal levels. But now doing what I'm doing, and Gary Donovitz, the CEO of BioT, which is the largest testosterone replacement company in the United States, wrote this amazing chapter in our book on testosterone replacement. You can get testosterone pretty safely back up to the level you were at when you were 20 years old. And it's really dramatic, the effect that it has on your ability to build muscle. Because as you age, so between the ages of 40 and 70, you'll lose 0.8%, so almost 1% of your muscle mass per year. But after the age of 70, you lose 1.5% of your muscle mass per year or more. It's called sarcopenia. And what happens is, first of all, your DNA gets damaged. With time, DNA gets damaged. Second of all, your mitochondria are the little power plants in your cells. They don't make ATP, which is your fuel, as efficiently. Third of all, your endoplasmic reticulum and Golgi apparatus, which are the protein synthesis sites in your cells, don't make proteins as well as they used to. And so there's a good reason why your body doesn't make as much muscle as it used to. And in fact, there was just a recent study, and stop me if I'm going in too detailed, but comparing younger men versus men over the age of 50, and 3 times as many genes were turned on in muscle in younger men versus men over the age of 50. And since I'm 54, that was really disturbing to me. So anyway, the power plant that your body is begins to wind down even after the age of 50. And it's really essential to do everything you can to maintain that muscle mass and circulation and quality of life, understanding that that's part of the aging process.
So a couple follow-up questions there. Are there risks to anybody to help increase the testosterone levels?
Absolutely. So if you have aggressive prostate cancer, you should not be on testosterone.
Okay.
Low-grade prostate cancer, we actually sometimes do replace testosterone. If you have an enlarged prostate and trouble urinating, deal with the prostate before you replace testosterone. It will make you lose a little bit of hair on your head. It will shrink your testicles, but there's a way to avoid that. And really beyond that, there's not a whole lot of risk of testosterone replacement.
So what about, you were I had all these questions in my head. I should have written it down. But muscle mass. Hey, I'm right in that category, so is whatever you would be providing, either from a medication standpoint, I'm not sure, maybe you could get into that, but would whatever you give increase the muscle mass or give the incentive to the individual to maybe do a little more work to increase their own muscle mass?
Yeah, so in the book, I have a chapter on the BrandeisMD male rejuvenation protocol for building muscle. And I've had unbelievable success. In fact, we're actually going to write it up for a journal. So I have a whole series of men in their 60s where I build 5 to 8 pounds of new muscle and have them lose 10 to 20 pounds of fat over a period of 4 to 5 months. And so that involves hormone replacement. It involves something called M-Sculpt, which I write about in the book. Actually, Brian Kinney, a famous plastic surgeon in Beverly Hills, writes the chapter on M-Sculpt because he did a lot of the original research, which is using high-intensity focused electromagnetic waves to rebuild muscle. And any Hollywood movie star now that you see that has six-pack abs is using M-Sculpt, whether they admit it or not. This is an absolutely unbelievable technology. It builds muscle in the body 10 to 15 times faster than you could do in the gym. We also, in my office, I have a body composition scale. So we do a calorie restricted diet based on someone's body mass index and basal metabolic rate. We have an exercise plan that is not excessive, right? You don't need to exercise 2-3 hours a day. You just have to, as you age, do it on a very consistent basis, 30 to 40 minutes a day based on the American Heart Association recommendations for heart rate. And so almost anyone could really do this muscular rejuvenation protocol. And testosterone really is your main growth factor, and it's really essential in helping you build muscle.
So how does circulation fit into this whole plan that you're talking about?
Oh yeah, circulation really is incredibly essential. Circulation really goes to everything. So first of all, circulation is essential to brain health. So for Alzheimer's patients, for dementia patients, really if it's organic brain disease, meaning the brain disease is actually occurring in the cells of the brain, there's not a whole lot that we can do these days. But if, and a good portion of this is vascular, right? How much blood flow we push up to the brain. And if we're not getting enough oxygen, if we're not getting enough glucose up to the brain, right? So the brain uses 20 and sometimes up to 50% of the oxygen and glucose that's in the body at any given time. I mean, think about it. How long does it take to black out if you're not breathing?
Right.
The brain is very sensitive to oxygen. And so optimizing circulation is really critical. And so there's chapters on foods, right? So it's essential that you eat a good diet and eat foods that aren't blocking your arteries, especially your carotid artery up to the brain. There's chapters on the heart and maximizing heart output and protecting your heart. And then even we talk a lot about nitric oxide boosters. When I was at UCLA, one of my professors won the Nobel Prize for discovering nitric oxide as a second messenger. And so I produce a supplement called Affirm from a company called Affirm Science. And that's a nitric oxide boosting supplement, really. So we talk about the importance of two supplements, primarily in the male rejuvenation protocol. The first is a nitric oxide booster, which helps your body open up or dilate blood vessels. And the other is creatine. Creatine helps your body regenerate ATP, which is the source of energy in your body.
Right. Right. So this is fantastic stuff. We're gonna have to take a real quick break. I promise we'll be quick, just to recognize our sponsor. And we come back, I'd like to talk to you more about some of the cognitive challenges people could get to at a certain age, and how to deal with that, and kind of going back to those doctor visits a little bit. So when we come back, we'll talk about both of those things. All right. Uh, so, do you know anybody who may be concerned about an older driver? Well, Senior Care Authority's Beyond Driving with Dignity program is a facilitated self assessment program for older drivers. This program has been designed to serve as a vital tool to facilitate older drivers and their families as they make appropriate decisions regarding the future of one's safe driving career. If the individual is a safe driver, an advisor will provide him or her with strategies on how to remain a safe driver as they progress through the aging process. If driving retirement is the appropriate decision, then the individual and their family are offered possible alternatives, resources, and a specific plan to ensure a smooth and successful transition from the driver's seat to the passenger seat. So to learn more, go to www.beyonddrivingwithdignity.com. That's www.beyonddrivingwithdignity.com, or you could call 877-907-8841 to connect with a Senior Care Authority advisor in your area. We're back now with Dr. Judson Brandeis, who is an award-winning urologist and sexual medicine expert. So, Dr. Brandeis, I know when we started, we provided our listeners with your contact information in case they missed it. Why don't you share that again, how they could get the book, get to your website, etc.
Sure. If you go to the 21st Century Man, all spelled out in letters, 21stcenturyman.com, that's where you can find the book. And we have a ebook, hardcover book, and very soon we'll have an audiobook. And if you are interested in me, go to BrandeisMD.com, BrandeisMD.com. And if you're interested in Affirm, the nitric oxide boosting supplement, you can go to Affirm, AFFIRM science.com.
So I do have a question. So we have listeners from all over the country, and actually we have listeners outside the United States as well, which is kind of cool. And I know you're based in Northern California, but can you service people or advise people outside of California? Do you have associates that you could refer to around the country that specialize? I mean, how would that work?
Sure. So I do second opinions and Skype consultations from all around the world. And I do have folks that fly in to see me. I mean, I think this past week we had someone from New York, someone from Florida, someone from Colorado, someone from Arizona, someone from Las Vegas. So people do fly in to see me because I do so many really unique and cutting edge things. And I do a lot of clinical research. And I have a YouTube channel, which is BrandeisMD, which you can, I do a lot of the stuff that would do during consultations on the YouTube channel. You can get that for free. And then I belong to what's called the Sexual Medicine Society of North America and the International Society of Sexual Medicine. And you can look those two up and find folks like me who are experts in sexual medicine.
Great, great, good to know. So I'd like to bring up something that really caught my attention when you and I had a chat earlier. And, this is something that I and my associates around the country deal with on a daily basis. And that's someone who's been diagnosed with what we call mild cognitive impairment, which in many cases, not necessarily all cases, but then could lead to some form of dementia like Alzheimer's. And and tell me if I'm incorrect, and I maybe heard you incorrectly, but you have some thoughts of the possibility of even reducing the chances of even getting mild cognitive impairment. Can you talk about that a little bit?
Sure. So the book is filled with advice on how to improve overall health and then even brain health. So we have chapters on mild cognitive impairment and how to avoid mild cognitive impairment or forestall the eventual dementia that occurs to pretty much almost all of us if we live long enough. And then there's a chapter that really deals with what's called the Bredesen protocol. And so that's not really my expertise. And so that's why in this book, I bring a lot of folks in who have expertises that are outside of my expertise. And they're the ones that wrote the chapters.
All right. So I'm going to shift a little bit also, because I know we touched upon it. Just advice you could give to people when they're dealing with their own doctor, and that whole process, maybe just overall advice and maybe types of questions to be asking, etc.
Yeah, absolutely. And that's a wonderful question because that's really something I'm very passionate about. And I think that's why the patients and physicians voted me as a top urologist in the Bay Area for the past 9 years, because I see my relationship with the patient as a partnership. A lot of folks think that they're doctors at the top of the mountain and whatever they say or do has to be done by the patient. But I understand that patients do best when they feel like they're partners with the doctor. But as a partner, you have to understand the pressures that doctors are under these days. So there was a study by Cerner, which is one of the largest electronic medical record companies, that showed that when they looked at 100 million charts, that on average, you're in the doctor's office for about 16 minutes and 14 seconds. And so that's not a lot of time. And so when the doctor comes in to see you, don't talk about your pet cat or the weather or football. Really focus in on your health. And an essential thing to do is to provide the information that your physician needs. So, for example, have a typed out sheet that has your entire medical history on it. Every medical problem you have, every surgery you have, do you drink, do you smoke? Then make a list of all the medications that you take and the doses. Make a list of all the labs that you've had over the past year or two, all the imaging studies that you've had over the past year or two, and then write up a summary of why you're actually at the doctor. If it's back pain, it's when did it start? Has it gotten better? Has it gotten worse? Where is it located? Is it radiating to your legs? What medications are you taking for it? Go into as much detail as you possibly can think of, and then write a list of every question that you want answered. And so with that 16 minutes and 14 seconds, it may take 5 minutes for the doctor to go through all the information that you have. But then after that, you have 11 minutes and 14 seconds for that doctor to actually think about you, think about your diagnosis, create a treatment plan, and then even talk to you about like, okay, I'm going to put you on this medication, but these are the side effects, these are the benefits, so on and so forth. So really, it's like when I go see my attorney is $750 an hour. So every minute that I'm with my attorney, it's $11. So for me, $11 is, lunch. And so every single minute that I'm with my attorney, I'm trying to maximize the time that I have with him. And so really that should be the focus when you go to the doctor or when you bring your elderly relative to the doctor, is how can we make the most out of this partnership with the doctor?
Right. Great advice. I like to, had kind of a question I was going to ask at the beginning. I didn't, and I'd like to go back to it because I think it's really important. And I'm sure this is an area that you can give some great advice. But obviously, people as they age, they worry a little bit about maybe premature death. Hopefully, I don't think about it too much, but obviously, it's a concern, especially as you age. So, give us your thoughts on kind of the most common health causes of premature death, and maybe some smart ways, suggestions you could give to help reduce those risks.
Yeah, that's a great question. And actually, the second section of the book is dedicated to the top 10 causes of death in men. So the book is really focused on men, but the 21st century man talks about cardiovascular disease, which is the number one killer. So, myocardial infarction or heart attacks, strokes is up there, cancer. So there's a chapter written by Ethan Bash, who's the head of the Department of Oncology at University of North Carolina, and a good friend of mine. And he talks about how to reduce your risk of cancer. Accidental deaths. So Malcolm Johnson wrote a chapter on stupid things men do to end up in the emergency room, right? And so there are so many things like, for example, 90% of eye injuries are preventable just by wearing safety goggles when you're out in the backyard cutting something up. 50% of hand injuries are preventable by wearing gloves. There are, I think, thousands and thousands of injuries of men going up on ladders. And it's important as you age, your balance isn't as good. That part of the aging process is accepting that you're getting older. So when you go up on that ladder, understand, one, your muscles aren't as strong as they were when you were younger. Two, your balance isn't as good. Three, your tendons and ligaments are more stiff so that you're not as flexible. Four, your nerves don't work as well, so your reflexes aren't as good. And five, sometimes your judgment isn't as good. And six, that you still think that you can do the things that you did when you were 20. And so that leads to a lot of falls in men, which leads to tremendous disability. And so in the end, pay your next door neighbor's kid $20 to take care of the gutters. And so those are the kind of things that are in the book. It's all about prevention and early intervention to help you not do the things that would cause you premature death. There's a whole section on diabetes. Gosh, I could go on and on, but I don't want to take up all the time.
Okay. Well, unfortunately, we're pretty close to out of time, but I want to give you the opportunity to just any words of wisdom you could just give to our listeners on anything that you wanted to cover, and we'll finish up with that.
Yeah, so there are a couple of themes that run through the book. So I didn't want to just make a book with like 101 chapters that weren't really organized in a really coherent way. And so one way the book is organized is how to feel good, how to look good, and how to have better physical intimacy. But the other way that the book is oriented is towards what we call the hero's journey. And it's a concept that comes from Joseph Campbell, who's a great mythologist. But really, it's you are the hero of your own journey. And the decisions that you make for your own life, if you see yourself as the hero of your own life's journey, really have amazing implications in terms of yourself, your spouse, your children, your workplace, your community. And so really see yourself as the hero of your own journey, and the decisions that you make for yourself and the people around you will be also heroic.
Great. Well, with that, Dr. Brandeis, thank you so much for joining us on Boomers Today. I can't thank you enough. Wealth of information. We've got to have you on again. There's so many subject matters that we could talk about.
Awesome. Thank you so much, Frank, for having me on. It's
Thank
really been a
you.
pleasure.
And I want to thank everybody out there for joining us. Please be safe, and we'll talk to everybody next week.
You've been listening to Boomers Today with Frank Sampson. To learn more about today's show, visit boomerstodayradio.com and join us next time for another edition of Boomers Today.